Welcome to the New York City Category Theory Seminar. Today is February 19th. Jacob Zelko is going to talk about Introduction to Compositional Public Health. Compositional Public Health. Take it away.
Awesome. Thank you, everyone.
The 4 pieces of information. Don't forget.
Absolutely.
Okay, good.
So, hello, everyone. My name is Jacob Zelko. Great to meet you. I'm a native of regional upstate New York, over by Ithaca, New York, specifically. Did my undergraduate training in biomedical engineering at Georgia Institute of Technology, and I'm currently working on my master's in applied mathematics over at Northeastern University. While at Northeastern University, I'm also a member of the RU Institute as a trainee affiliate, which is dedicated to bringing cutting-edge health research developments up along the New England corridor. Additionally, I'm engaged still actively within cardio-oncology research, health equity research, and thoughts around how do we innovate in the public health research space. Beyond that, in the open source software movement or development ecosystem, I'm the leader of the Julia Health organization, dedicated to bringing high performance computing to health research, and also the co-administrator for Google Summer of Code's Julia programming language project. So all in all, that encompasses about 15,000 people across the globe. Previously, before coming to...
I'm sorry about that.
Should we restart?
Not me, no.
Okay. So previously, before coming to Northeastern University, I was employed and worked at Georgia Tech Research Institute and the United States Centers for Disease Control, specifically in the years 2021 to 2023. This was a dual role where I was in the GTRI's Health Emerging and Advanced Technologies Division and the CDC's Office of Science. Now, there were several different projects that we worked on, but primarily, as you can tell by those dates, I was engaged with the COVID-19 response across the United States, oftentimes working with the mitigation policy analysis unit and determining what might be the most efficacious sort of policies to implement and explore across the United States during the COVID pandemic. I was also the PI and grant overseer of research in chronic mental illness and health disparities in a transnational collaborative study encompassing around 150 million patients across 4 different countries. So today I want to talk about compositional public health. This is a rather nascent emerging field that between myself and my close collaborator, Professor Nathaniel Osgood at the University of Saskatchewan, we have defined as the following definition for now, which is compositional public health is an emerging field at the intersection of category theory, public health, and engineering, which utilizes tools from applied category theory for applications across public health. I want to give that definition first, just to kind of give a sense of what we'll be talking about, and then throughout this talk we'll be breaking down what each of these little parts of this definition mean. To give a sense of the type of different questions compositional public health can answer or is interested in exploring, say for example we want to work on a public health related problem that involves strongly heterogeneous data sets. Like a typical example might be if there is a researcher in a public health setting who wants to investigate the impacts of climate on particular diseases. This would be something that would require one pulling in multiple different data sets. Say, for example, if we're looking at heat-related diseases, myocardial infarction, also known as heart attack, or stroke. These are, again, heat-impacted diseases, or cold-impacted diseases, such as seasonal affective disorder or musculoskeletal damage. Both are climate-related and would involve researchers pulling in information from both patient populations, climate-related conditions, and even socio-demographic or socioeconomic statuses of these patient populations. Additionally, other sorts of questions or species of questions that we might be interested in is the notion of the reuse of knowledge discovery pipelines. So knowledge discovery is a term that we'll be using throughout this presentation, and to give a sense of what that means, knowledge discovery is this notion of, for example, if you have a data set or a collection of information that you want to derive insights from, you would maybe go through it and apply various statistical methods, scrutinize it, do some manipulation of information to answer perhaps a research question or a sort of question about a population you're interested in. So knowledge discovery is this routine notion of investigating data, and a pipeline would be saying that systematic process of taking data, structuring it, organizing it, cleaning it, preparing it for analysis, analyzing it, and then deriving some sort of result at the end that actually gives you a meaningful conclusion to an answer that you're investigating. So this is the notion of knowledge discovery pipeline. For example, in a public health setting, imagine if there are two different processes or two different pipelines where researchers studying the same population, but maybe addressing, or the same patient population, but asking a different question on these populations. Perhaps at some point they notice that their pipeline that they've created is very, very similar, and they might be wondering, oh, maybe how could we reuse the same pipeline over for this other study, or if there's maybe, say, a third study in the future, how could we keep reusing this pipeline with maybe few minor tweaks going on in the future. And then the thought is perhaps even if a researcher wants to combine research questions or combine the study that they're doing together, these two different studies that they're doing together, how might they be able to meaningfully combine these studies together into one study? Can you even say take these studies together as you combine them and simplify this combination that you get at the end? So to give an example of what some of these diagrams might look like in a public health setting, or how some of these studies in a public health setting might be described, seen here are two diagrams that are prevalent across epidemiology in public health settings. On the left-hand side, we have a causal loop diagram describing smoking cessation. On the right-hand side, we have stock and flow diagrams, which is, in this case, describing the kind of canonical compartmental model, the SIR model with populations of susceptible, infective, and recovered populations. As you can see, these diagrams encompass a lot of variables as well as attenuating and maximizing factors. Something to keep in mind is that these diagrams, both in a team-based setting as well as in research settings, can grow up to be very, very complicated. For example,
Can you go through the one on the left? Just explain what's the pluses, what's the minuses, why.
How the causal pathways are. So, just very broadly to give an explanation here. The notion is if we have, say, one variable smoking, the positive labels on these arcs would say this is a strengthening or reinforcing sort of mechanism that says smoking is reinforced by time spent around other smokers, social ties to other smokers, and negatively, that's you can't see it very well, but there's this minus sign here, and that says this is an attenuating factor to one's commitment to cessation. So, for example, if we instead go follow this loop here, where we say smoking, if one is considered or concerned about one's own personal health, there might be either a negative or positive commitment to cessation just based on how actively they're still involved with the smoking process. So,
from health to commitment to cessation, I mean, do you think that would be a plus?
Yeah, so that's what I believe, based on this example here, the overall positive loop here means is that this tries to capture, in general, the sort of overall effects taking place around a smoking population. So you're right that it does seem like the interpretation might be saying health would be negatively impacted, or should be, like this should be one's concern about health should be strengthening one's commitment to cessation. But you could also interpret this, there's a bit of ambiguity here. We can also interpret this as saying, like, if one is not smoking so much anymore, they might be less concerned about their personal health, and they might not be so committed to cessation because they're no longer smoking. And
yeah, so basically these self-reinforcing, they're key to one particular, in this case, all these diagrams are about smoking in particular, right?
On this left side, this is smoking.
Yeah.
On this right side, this is talking about general spread of a disease in a susceptible, infected population. Yeah.
What do the different colors mean?
That's interesting.
Yes, so it's kind of similar. So blue is like a compounding or maximizing factor, whereas red arrows mean sort of a attenuating factor. So that's what the two colors mean here. But what I just wanted to more or less emphasize from these two different diagrams is that they can grow to be very, I would say maybe in a sense, cumbersome when one is approaching patient populations, especially when one starts working in a team-based or team research setting. They can grow to be extremely complicated. So this is actually another stock and flow diagram created for, I believe, the COVID-19 pandemic response in I believe it was either Canada. I want to say it was the Canadian response here. But this is just one COVID-19 model using stock and flow modeling created by a team trying to capture all the different variables that one might be concerned about in a given regional setting for a particular disease, in this case being COVID-19. So just to emphasize again, why you might be interested in composing or combining studies together is the notion of, can we actually simplify and make this entire process easier, especially across collaborative team environments? So the structure of this talk is 4 parts. We have just basic motivation, a little bit background of compositional public health and examples that I think fall into the compositional public health umbrella. We have some basics on applied category theory, some demonstrations that I prepared based off of work that I'm doing in my current master's thesis, and just some open questions and maybe how to get involved if any of this is interesting to the broader community here at CUNY. So moving on to motivation. So the first bullet that the first part of this definition I want to talk about is public health. So compositional public health is an emerging field at the intersection of category theory, public health, and engineering. So what is public health, or how does that come into play here with this talk today? So for me, public health was how I engaged or started working within public health is especially when I was in the CDC COVID-19 response. Here, what we're generally very concerned about was how, in the case of COVID-19, this disease was being spread across the country, how it was impacting not only people's health outcomes, but also various population dynamics, such as mobility, such as transmissibility, things of this nature, and how these responses looked like in the CDC is that many of these projects that we worked on happened to be extremely rapid turnaround. It was no exaggeration to say that sometimes we'd be asked by our CDC partners and counterparts in the Office of Science that they want some analysis done in the morning, and then by perhaps later that evening or afternoon, they might be asking for those analysis results by the end of the day. So it was very rapid sort of turnaround with these projects, and in fact, most of them ended up being rather, in a sense, data science-y, or as we were talking about earlier, more general knowledge discovery processes where we're more or less looking at descriptive statistics to capture at a high level what was happening with the COVID-19 pandemic across a variety of populations. And the reason why we're so interested by this was we're trying to capture, again, what was happening when certain policy level effects might be going into play, what are the developments happening with the disease, because as I joined the CDC at that time, this was 2021, so this was when we had all of the variants like Delta, Omicron, so on and so forth coming around with the COVID pandemic, and then also how this breaks down and percolates into national and subgroup effects. So meaning things like minority populations and various fragile or very, very at-risk populations across the United States. And for me, just to give my motivation for compositional public health was I was a bit frustrated during this response. In particular, a majority of these project pipelines, when we worked on them, felt the same in a way, but there could be a slight change, be it in the data sets that we were using. Perhaps a column got changed, a type of the data was changed or something. The requirements changed from maybe how the disease was evolving or how the CDC was requiring us to do certain research investigations. And also relationships might have been recently uncovered that would put into effect some novel sort of factors that we had to take into play with our analysis pipelines. So as a result, the project pipelines felt the same, but there was oftentimes changes that cost us a lot of time, and we had to do something to ameliorate those concerns that people had. So if I were to describe it in the sense of an analogy, is it oftentimes felt like I was on a ship that was sinking. And on the ship, just because I was expecting it to be a brief journey, all I had on hand was a pitcher, and I could use this pitcher to bail out my ship, but unfortunately this pitcher was not perfect. It had a hole in it, so the best I could do was keep bailing out my ship as I tried to navigate back to shore with this very inefficient method that I have, but it's the only thing that I have on hand and the only thing that I can do at the moment while my ship is sinking so I don't drown. And as I'm doing this process, there wasn't really time for me to think on the ship what to do better. Same when we were working in this response, there wasn't really time to think or do really actively, how could we perhaps have a better approach to this in the, right now? We just didn't have that when, lives were in jeopardy. And so this led me to thinking about a structure that was really fundamental and much more broad that can capture these sort of robust changes needed in a pipeline change, or how a change might occur in one's discovery process around the evolving nature of a disease. And so this is analogous to me looking for, instead of a picture that was not really really effective, it'd be having the analogous solution of a bilge pump built into my boat, that if there's ever a sink or if there's ever a hole or a leak, I can flip a switch and that drainage system just works perfectly. And instead, we did not have that at that time, but that's what brought me into considering category theory and mathematics. And so to talk about the background further of compositional public health, as I mentioned earlier, we have a couple different topics here to talk about. So I said compositional public health is an emerging field at the intersection of category theory, public health, and engineering. So in this background, we're going to talk about two main topics, being the category theory framing as well as the engineering background. So let's just go ahead and dive right into it. To kind of give a quick overview of the nature of compositional public health literature and how it's emerging in the recent years is right now there's been a variety of different efforts taking place in the applied category theory landscape, where we're using applied category theory methods to leverage public health expertise, oftentimes in team-based settings. So shown on the right-hand side here are three different publications that I'll highlight in just a moment. But these are just three examples of some papers coming out that I would say fall into the seminal literature of this emerging field of compositional public health. But there is one point or one problem that I still want to bring up about a lot of these publications and the work being done in this space, is that oftentimes, researchers still have to wear multiple different hats. What I mean by that is, for example, with some of these authors here, probably names somewhat familiar to some folks in the audience, is that right now, some of the researchers needing to do the research have to have both a background in, be it category theory, broader mathematics, computer science methods, data science methods, as well as public health and epidemiology backgrounds. So as a result, right now, we're still at this nascent stage of compositional public health where people still need to wear multiple hats. And to kind of give you a sense of some of the effectiveness of compositional public health so far and some of the approaches people are using, let me highlight one paper here, which I referred to earlier. And to give the full name of this paper, this is an algebraic framework for structured epidemic modeling by Lebkin et al. So this was written to capture and to think around how can we use an algebraic framework or categorical methods to actually capture the rapid development process or the rapid evolving understanding of a disease model in real time. And why that might be important is that as researchers in the field of epidemiology, public health, so on and so forth, determine and understand more knowledge around a particular disease, these updates that one might need to make between someone's theoretical model and the implementation of a model are a very costly and time-consuming process, not only because that means maybe redoing or refactoring part of maybe a piece of software or dissemination protocol, but that might also lead to errors being introduced in one's model as one is doing these repairs to the model as reflected by the developments of a pandemic or a disease situation. So this algebraic framework took a approach to think how can we capture the domain-specific knowledge of an epidemiologist, public health official, with and marry it to the actual mathematics of category theory to better actually think through how could we have one's discussion around a disease, an understanding of how a disease is evolving, and combine that with actual mathematical modeling needing to take place. And the thought was, and eventually, and I'll highlight this in a little bit, the thought was, is how can we bridge this thought that scientists might have, how can we encode this domain-specific knowledge, and translate that into the code that implements them simultaneously. So shown on the left-hand side here are depictions of 3 different models based on Petri nets. Petri nets are extremely useful and well understood in category theoretic language. But just to give a quick highlight of what is going on here is in this square here we have 3 different models to understand a particular disease using the compartmental model I was mentioning earlier, SIR models. And these 3 different boxes, denoted by the blue, purple, and pink boxes, represent 3 different models that people have taken to understanding the actual disease that they're studying. And if you notice, going back here, these are compartmental models, but they vary based on how the different research teams understood the creation of these models. So on the right-hand side, we show how these models can actually be composed together, where their gluing mechanisms take place. And then on the bottom left is that final glued together model that we actually have of how we can combine 3 different models together to actually give us not only a comprehensive picture of the disease, but one that integrates all elements of the individual teams' understandings of the disease developments, and actually result in a model that is perhaps even more simplified at the end instead of having to try to understand all 3 models at the same time.
So the one on that SIR one, that was the one you showed before also, right?
Yes, so if we go back to the beginning, it was that stock and flow diagram with the blue and the red arrows.
But now you're using Petri nets.
Yeah, now we're using Petri nets, which is just, it's another language that one can use to understand SIR models. And the variations here are different variations of the SIR model with things such as V, such as these are other populations that people can further define within these contexts. And but exactly right. These are what were shown earlier, and this is how the gluing can happen. And actually, to speak to your point specifically, if we go back to the stock and flow diagrams I mentioned previously, we can now actually summon another piece of literature, which is the publication Compositional Modeling with Stock and Flow Diagrams by Bayes et al. And here, if you recall from our initial example talking about stock and flow diagrams, we're looking at that kind of mess of blue and red arrows showing attenuating variables, so on and so forth. This, again, as I mentioned, is a diagram that's widely used in epidemiology, very useful in capturing population dynamics. And here, just in lieu of a diagram that shows how the compositionality occurs, here the compositionality occurs via decorated coast bands, so that's where the gluing processes can occur. And what is great here is that the categorical understanding of stock and flow diagrams actually gives us the ability to separate the syntax of stock and flow diagrams from the semantics of stock and flow diagrams, where in general, what these boxes represent are what are called stocks, or the populations or the sources, and these little arrows in between the stocks represent flows or the variables that we would be interested in affecting different populations, attenuating or maximizing these populations. And once one understands stock and flow diagrams within the category theoretic language, we can have a broad general syntax that can be more generalized to various populations, and then eventually attach actual meaning and semantic meaning to a particular disease or population of interest. One piece of software that I will highlight in a little bit is stockflow.jl, which allows one to actually compute on stock and flow diagrams in a categorical theoretic framework. Just to give kind of like a teaser for that next part of that discussion is a figure on the right-hand side, not only of showing a simplified stock and flow diagram, but also the code that describes how the flows work between these populations. And then kind of the most exciting, or at least in my mind, one of the more exciting aspects of where the modern or the recent developments in applied category theory is taking place is within the Topos Institute's development of CAT Colab. And CAT Colab is a platform for collaborative modeling. So what this idea is it's a structure editor for categorical structures. And what we mean by that is that content in this editor is itself an object that is both understood in the semantics of how it's presented, as well as the underlying syntax of category theory. I'll show an example of what this means in a minute. What that allows us to do, or what this place allows us to do, is that it exists between text editors as well as graphical editors, where one is able to actually work within the framework of mathematical syntax by construction, and actually enables one to have a general sense of the structure of an underlying model by construction, and it's generalized across one's discussion of modeling. So to give an example of CAT Colab, give me just a moment here to pull this up. One can actually encode and demonstrate various aspects of various sorts of problems that people might be interested in, such as Navier-Stokes and viscid vorticity. This is presented as an example of discrete exterior calculus, and this is both understood generally in terms of the syntax shown, or the semantics shown here on the left-hand side, as well as the actual semantics under the hood, are all placing this within a category theoretic framework. Now, I just want to show this as a quick example to show how complicated you can kind of get with this. We're going to get to a simpler example in just a moment, but just to show that within CAT Colab, you can actually take a model that you're working on. So going back to our initial discussion around how one might be able to be a public health or epidemiologist researcher describing a theoretical model. Now, not only can we describe that theoretical model, we can do it together collaboratively, and we can encode that into a platform such as CAT Colab, where eventually, and this is a long-term goal of CAT Colab, one can actually attach semantic as well as model details for an actual implementation for a collaborative sort of model that comes out at the end of various discussions in public health settings. So give me just a moment. There we go. Okay, so I mentioned earlier that there's two parts that I want to talk about for this section, being the category theory as well as the engineering. So now I want to talk more explicitly around applied category theory. Particularly, I want to center some of the discussion around the paper of algebraic databases by Schultz et al. In my mind, just to give a quick slogan for what I think of when I hear the phrase applied category theory, I think applied category theory is just, generally speaking, category theory applied outside of just mathematics itself. And I think, when I think of the current rise of category theory, I also think of the current work being done by the Topos Institute, as well as maybe centered around some of the work from David Spivak or Brendan Fong, some of these researchers right now. John Carlos Bays leading a lot of the modern sort of, I feel like, evolution of category theoretic thinking. And of course, there's others such as Andrea Sensi, Joel Zardini, folks such as these doing all sorts of work across the globe. And, you know, applied category theory also does have a huge history, both within relational database management systems, programming language development, all from the inception pretty much of category theory itself. But today I'm just going to talk about mostly the applied category theory I think of circa maybe the mid-2010s to today, and starting with the work of Schultz and company with the paper of algebraic databases. So to kind of talk about what makes possible the current developments within compositional public health, like how we can understand the modeling of disease in categorical language, categorical framing, is I think where it starts from is this work by Schultz on algebraic databases. So to go through this kind of example or this procedure, let's first talk about database schemas. So database schemas broadly describe as a blueprint how data is stored and represented within a database. If a database is just where data information is put from a knowledge discovery process, be it patient populations, disease information, so on and so forth, a database schema is simply that blueprint where it says, hey, here's our database, and here's how this database is laid out. This database schema describes database components such as tables, how data is laid out, attributes, how tables relate to one another, and an important distinguishing feature here is that the database schema itself does not contain the actual data. The database, well described, does actually instances of the database as where the data is found. So to give an example between the difference between schemas and instances, on the left-hand side here, we might have a database that has two tables, which is the table of employees and the table of departments. And this just simply defines what these two tables, the database schema on the left describes simply what these two tables contain. So these two tables contain name and employee IDs within employees, and departments contain name and department IDs for the department's table. Now, on the right-hand side, we actually have an instance of a database following this database schema where we have one employee, Jose Perez, with employee ID 1 and department with department ID 1 in the name mathematics. So just to give an example between what is the difference between schemas and instances, that's the example here. And database schemas themselves can actually be understood as finite categories. So if we go back to our two tables, we can think of the relationships between employees and departments as describing a finite category. And it captures the interactions between rows of database instances and based on the columns of the tables. So we can actually capture between these two tables how these two tables might relate to one another. If someone wants to look up, say, where Jose Perez works within this company or this department. So yeah, so moving on from here, so as I mentioned, we can understand these database schemas as finite categories. Let me pull up an example from Cat Collab to show what that can look like. So give me just a moment. Okay, great. Yeah, so shown here, using the language and vernacular coming from the algebraic databases paper, we can define two schema tables being employees and departments. We can define attribute types. In this case, we're going to define the attribute string to represent that there's string information being stored within this database schema. And then I'm going to define two attributes that we just explored within the database, being the tables having employee name. And this is going to be a string like Jose Perez.
Okay,
Yes.
So just to be clear, okay, so here the objects are just different tables.
Yes.
As opposed to different rows inside a table or anything like that.
Yeah, and then the morphisms in between them are like how we're looking into the tables or how they're connected to one another.
Okay.
Yes. So then continuing from there, we also do the same thing with department name. We define table mappings between these two tables. We're actually defining three mappings here. One is going to be the identity morphism, which is just the employee ID in that row. So when we looked at Jose Perez had employee ID 1. So that's going to be our identity morphism. And same with departments. Our department ID is our identity morphism. So we have those two arrows drawn there. And then we also say that there is a relationship that exists between employees and departments. And these would be the morphisms or how these two tables are related together. Just to give an example of what you can do with Cat Collab to describe these schemas is on the right-hand side, we have the analysis or the visualization of how we fully describe this schema. So again, like I said, if one is in a team-based setting, one can actually work together to come together to a consensus of what these diagrams can look like. And this is just two different orientations of the same diagram. These diagrams are the same thing. One is just hierarchically ordered vertically versus horizontally. And I know at some point CAT Collab will actually support one's ability to have multiple people working together on the same notebook at the same time. Yes?
That's what I'm wondering about, because you have the employee ID. So
Yeah.
is there an example you give, let's say, of a different automorphism that isn't just the ID, or would you have those here?
I didn't actually prepare them for this example. I do have an example next that I think might answer your question.
Yeah, well, there's one, but you can have such things.
Yes.
We'll show one, okay.
Yeah, yeah. And if I don't, let me follow up with you on that for sure. Yeah, so moving on to perhaps a slightly more complicated example. Give me just a moment. Here we actually have three different tables this time. We have employees, departments, and projects as three different tables. We have strings. And here I've dropped the identity morphism so that we don't have the self loops anymore. But with the attribute information, we actually have one additional column, nickname, that also maps to string as an attribute type. And shown on the right-hand side is just how you can continue to iterate and evolve your database schemas or your understanding of a schema for how information is stored in this very open, collaborative sort of environment. So again, as I mentioned earlier, CAT Collab gives us the ability to not only reason about these models both from a database sense or a database point of view, but underlying the syntax, like this semantics, so here we're using the three examples of employees, departments, and projects. As you pointed out, these three tables are going to be in themselves in category theory language, objects of themselves. There is under the hood of this framing up here, that categorical, that mathematical understanding within the language of category theory. And that's what brings us to, I think, the most exciting evolution of what I consider like some of the modern tools within applied category theory.
What's the difference between the top diagram and the bottom diagram?
Oh, just their vertical and horizontal arrangement.
Right, so it's nothing. So it's just, you're showing that people change things in the public thing, in the public page?
Yeah, yeah. So like right now, if you wanted to, you could look up, I could provide you this URL, you could change it which way you want. The reason why there's two diagrams here is just because this is just the top-down ordering from, I guess, this object here, and this is a horizontal ordering. So they're exactly the same thing, just how they're presented looks different. It's just a visual layout aesthetic. Yeah.
Probably a silly question, but why do they all go to the same string? Is it just to show the typing? Or?
Yes. Yeah. So it's to show to keep as close as we can to the database language, because in databases you have types known as like strings, ints, floats, so on and so forth. This is just to show that the attributes that belong to the tables, those attributes, terminate and a particular type. In this case, they all go to string.
Now, when you have a string, do you think string is an object in your category, or do you have string somewhere else and this is a functor out of the category, or how do you describe that? Yeah,
so in this case, and I'm about to get to it, I describe them as attributes or attributed C-sets. So what we can eventually understand this framing here as is, if we have the presentation right now of this being a database schema or just a schema in general, when we start to actually attach semantic meaning, that attribute sort of information, that is what I refer to as attributes, and that information is coded into an applied categorical theory data type called attributed C-sets, or colloquially known as attributes. And I'm about to get to that.
What does C-set stand for?
Oh, it's functor.
No, this is a category C, and it's functors from C to set.
Yes, exactly right.
Oh, okay.
Yeah.
Okay. Now,
Also called co-prescience.
what?
Yeah.
Yep.
Also called algebra functors from the theory of that database.
Or like in the database language, you can think of it as a table with only one column identity, specifying every possible string, and you're just pointing to it.
Exactly.
In which case, all the objects are the same then.
Yeah.
That's why because Spivak has this whole thing of you can name all the types, right? So you can have a string type that's like department string and project string.
You absolutely could. I opted for a simpler demonstration here just to show that they're all the same in database language type, but you're exactly right. Like this could be, there could be maybe a type that's like name or something. And we have, instead of string here as an attribute, you could have name, and that would also be completely valid. It's just, I guess, which level of abstraction that you want. Here, I was using this attribute relationship just to show that these are all strings, or strings stored in a database. Yeah. So let me come back to the presentation. Yeah, and this was just a backup in case if the live demo happened not to be so live. So coming back to what I was mentioning earlier about attributed C-sets, as well as what I'm very optimistic about for the future and what is giving rise to these current developments taking place in compositional public health and making this actually be useful in public health settings is, I think, the really amazing pioneering work done in the algebraic Julia ecosystem. This is a, I'd say like a very broad, interdisciplinary, as well as, I think at this point, international scale sort of collective of researchers from across the globe working together on how do we operationalize, per their slogan, bring compositionality to technical computing. And shown on the right-hand side is just a small sample of some of these folks who are involved in the algebraic Julia ecosystem. But the algebraic Julia ecosystem itself is an open source research software tool stack written in the Julia programming language, which is dedicated to bringing high performance computing in language that looks very similar or simplistic as Python, or speedy as performant as C. And their whole goal is how do we translate ideas from category theory, or specifically applied category theory, into the code needed to either implement or run that model.
Can you just read some of the names because it's so small?
Oh, absolutely.
You're all the way on the right.
I'm all the way over here.
Other than that, some prominent names.
Yes, to give a highlight and shout out to especially some names here, we have Professor James Fairbanks from University of Florida, who runs the GATES lab. I'd say James has been really pioneering a lot of work here. We also have, and I should mention this diagram is rather outdated. For example, Chris Brown, who was a postdoc over at University of Florida, is now employed and working at the Topos Institute. We also have Dr. Evan Patterson at the Topos Institute. Not shown in this diagram is Doctors David Spivak and Brendan Fong at the Topos Institute as well. We also have to the top right here, a variety of contributors from Georgia Tech Research Institute. I know many of them have moved on, including myself from that institute. But just to give a sense of kind of the growing and evolving network of the algebraic Julia ecosystem and community, there are a variety of folks still engaging and getting involved with the work being done here. I will say I'll provide more information about the algebraic Julia ecosystem and who to get in touch with or how to get involved with this ecosystem a little later in the presentation.
So you also lie in the image of a functor.
Yeah.
Algebraic Julia is also a category. That's what we learned.
Yeah. So
Nicely done.
yeah, I'll say just very quickly a fun fact is that this diagram was actually created by one of the software packages within the algebraic Julia ecosystem. And that was created by Owen Lynch, actually. So Owen Lynch is now over at University of Oxford with Sam Stanton's group. So yeah, like global reach at this point, super exciting. And as I was mentioning, so this is a open source software stack that consists of a variety of different packages. Shown here is just a quick snapshot of, this is not an exhaustive list by any means, but these are a couple different packages that exist within the algebraic Julia ecosystem. And today's talk, I really want to highlight two in particular, being CatLab as well as Atchits. And to give a quick overview of CatLab, I would say that CatLab is kind of the central hub or the core critical package within the algebraic Julia ecosystem. And as it says, it is a framework for applied category theory. And I think it does an exceptionally strong and great job of doing that. It's given rise to a lot of these packages that you saw, or these examples that you saw earlier from various papers coming out across the globe. And I'd say CatLab is that underlying software that folks are using to actually bring categorical ideas to life in practical settings within public health. As it also says, is it's a programming interface for applications of category theory. Just as a fun small example on the right-hand side is how to create a little wiring diagram using CatLab itself. That is the code that you need to do that. And then that's the image that you can actually get at the end as a result. So you actually can have your, not only your mathematics encoded into the code, but you can also have the figures that we know and love within working with like operant algebras. And they emphasize a broad use of monoidal categories that end up being widely applicable across the entirety of the algebraic Julia ecosystem. And finally, we get to the package or the tool that I think I'm the most excited about, which is CatLab and attributed C-sets. So this is actually, just to put it into context, this is around the time when I got involved with the algebraic Julia ecosystem, and even category theory in general is when this work was coming out. So this is work done by Dr. Evan Patterson, Owen Lynch, and Professor James Fairbanks. And this paper is Categorical Data Structures for Technical Computing. So attributes understood in the language of like CatCollab, the example that we're just showing, are really broadly put, or generally put, is that they are instances of database schemas. So if we go back to our example, and I have an example that I'll show in just a moment. If we go back to our earlier example of how we understood the employees and departments tables, attributes actually contain that data or that information that we want to be encoding within our tables. Again, attributes contain a variety of data attributes, and in my opinion, enables a wide variety of computation within this categorical framework that has given rise to various applications within compositional public health. And to give a quick example of how we might define or describe a database schema within the language of algebraic Julia, specifically the CatLab interface. Say, for example, we go back to our employees and departments here. We have the name Amelia Guzman. We have, again, our department mathematics. On the right-hand side, this is known as a presentation of our database schema. So this does not encode on it itself the data just yet, but this is actually a description of how the tables interact with each other, or how the tables are understood as a finite category. So shown in this presentation, we have employees defined as an object per our table. We have departments also defined as an object. We have employee names described as an attribute. In this case, as you were saying earlier, we could say that this was a string, but in this case I simplified it and said this is a name. Similarly, we have it for department name, and then we have the homomorphisms that exist between the two objects, being a homomorphism from department to employee, and also a homomorphism from employee to employee as a identity morphism. But just to give an example of how we can actually take the attribute interface and recognize and translate our database schema into this interface, that's an example. But here we can actually then begin to apply and connect data to these attribute interfaces that allows us to do technical computing. So as I mentioned, attributes and compositional public health, I think, is an awesome example of how we can actually start bringing applied category theory to various domain-specific use cases. So I'm not going to go too broadly into this in this talk, but just to say how one could further research how these understandings are taking place. is that these diagrams that we've been looking at, the stock and flow diagrams, the Petri net diagrams, the causal loop diagrams that we were looking at earlier, these can be understood and interpreted in terms of categories themselves. So stock and flow diagrams, again, earlier Lipkin et al. Has a really nice description of a variety of different ways stock and flow diagrams can be understood as categories. So there's actually the category stock flow, which is defined by Lipkin et al. Atchits can then really capture this notion of how a diagram in public health speak can be presented. So if we go back to our example from the previous slide here, we have databases as well as tables. We can understand that in the Atchit language, but just as well, we can now actually understand these more complicated diagrams, be it Petri nets or stock and flow diagrams, similarly using the Atchit interface, because these can be understood categorically. And finally, we get to that exciting notion that allows this to be an entire framework for computation within the setting of applied category theory and applications in compositional public health. So to kind of wrap up this part of the discussion is what is the ultimate goal of compositional public health? And it's this notion of mixing together public health domain needs with applied category theoretic approaches. Just again, here's our definition on the right-hand side. You know, our ultimate goal is to think, how can applied category theory be used for applications all across public health? And the dream would be that rather instead of one needing to know everything about epidemiology, mathematics, computer science, data science, so on and so forth, this can be a place or environment such that we can bridge together conversations with mathematicians and public health practitioners together, such that there's no longer a need for hybrids, people who wear all these multiple hats at the same time, but rather only hybrid approaches. And so that way we can actually have meaningful impact within a public health environment.
So it's again category theory doing one thing it does well is serving as a common language.
Exactly, exactly. And it enables one to bring together mathematicians, epidemiologists, so on and so forth. And I'll talk a little bit more about some exciting plans that we have there for that. But yeah, so moving on to the third part here of this talk, and I lost track of time. How are we doing on time?
8.
It's about 8 o'clock.
8 o'clock, okay, thank you so much. So moving on to some demonstrations of actually, you've heard me talk about applications, people doing things with applied category theoretic framework. Let's actually show some stuff here that we're doing. And in the course of my master's thesis project right now, I'm focused on 3 main topics, which is explore categorical data science techniques in knowledge discovery involving heterogeneous data, prototype realistic public health applied category theoretic studies, and also push the boundaries of applied category theory and what research questions can be answered using state-of-the-art tools within applied category theory. Just to give a brief description of categorical data science, because it wasn't something I really had covered yet, I just want to give one more framing before we dive into these examples. When I say categorical data science, categorical data science really is this emerging sort of, I'd say, maybe approach or description of how one can use categorical data structures for data science approaches in general. And unlike maybe some other approaches like topological data analysis or other approaches, I would say that the distinguishing factor about categorical data science is it's really more about the integration of data assets together. Again, one of my close collaborators, Professor Nathaniel Osgood, and I had this discussion where we both agree that categorical data science as a whole right now still is perhaps not greatly defined just yet, but we see it as a really great place to do data science. And I put like a little asterisk next to that statement to say, to some extent, we're still fully fleshing out what we mean by categorical data science. But again, we see it more as an integrative framework that takes together and subsumes different sort of approaches rather than just saying this itself is the method to give you a statistic or a metric at the end of the day. But again, it's an evolving space, and I just want to give a quick context to what I mean by categorical data science. So my approach with my master's thesis is that I have been investigating a rather difficult research question focused around climate-impacted diseases. In this case, I'm particularly looking at myocardial infarction, otherwise known as heart attack. And for that, as I mentioned in the earlier example in our talk, I've been looking at various data sets that could be used and understood in categorical language. I've been working to translate the database schemas that are present within these data sets into attributed C sets. And then finally, thinking about how we can explore the results of this sort of computational process. So number one, I want to talk about the data sets that I've been looking at for investigating this process, or this problem. So the first data set I will highlight is census and survey microdata. Census and survey microdata is available globally in a variety of different countries and contexts. Here I'm using the wonderful platform that I cannot speak more highly about for this particular data, which is IPUMS. As I said, it's internationally available and it's also free. And we also have a variety of different software packages that are available to work with this data and pull it from public sources. And in my study right now, I'm using the current population survey data publicly made available on the United States. So let me give a quick demo just to give you an example of what this data looks like. So give me just one moment. Okay. Can everyone see that okay? Is that okay? Okay. So to give a quick summary of IPUMS CPS data, this data exists at 3 different levels. It exists at the household level. It exists at the person level data. And it also exists at the labor force level data. So that means we have information about a person's household, like how many people might live in the household, how many children are in the household. We also know demographic information about individuals in that household, be it are they of a certain age range, are they making a certain income bracket or income level, what is their educational attainment status, and then also when it comes to labor force information, we can also know if they're employed, unemployed, seeking employment, that sort of information. So to give a quick example of what this looks like in terms of data science speak, here we're loading in the data, and here's actually what the data looks like coming straight from the census. So we have data by the year 2011, we have different months available, and then we also have all this different information about that particular row representing a subset of the patient population being surveyed. So we actually have information about each of these columns because, as you saw, some of these names just do not really make much sense of their own, so we kind of need a lookup table. So we can actually scroll down and look at the metadata that's surrounding each of these variables. As you can see, there is, in fact, quite a lot of information about each of these variables encoded within the census. But I just want to show that as an example of a data set that I'm looking at. So let's jump back over to the presentation for our next data set. Our next data is weather and climate data. This comes from the National Centers for Environmental Information. It's naturally comprehensive, available, and free. And we're using, in this case, data from the NOAA Monthly U.S. Climate Divisional Database for the year 2011. I'm not really going to go over an example for this because we're just looking at average temperatures recorded per state. That is a very coarse level coarse example here. Of course, you can go much more in depth with climate level data, be it with metrics from reanalysis, that sort of thing. But we're not going to go into that too much. But the most important data set, I'd say, in this study so far is the actual patient level data set. So the patient level data here is the Cynthia OMOP CDM patient medical claims database. And that's a lot, but what that is the OMOP CDM, otherwise known as the Observational Medical Outcomes Partnership Common Data Model, which is abbreviated OMOP CDM, is a internationally recognized and used database schema to describe how patients that are entered into a hospital system, be it visiting a hospital, an urgent care clinic, so on and so forth, how each of these events are recorded and stored into a database setting. The OMOP CDM has become a standard in many places around the world for this collection of data, so much so that I believe South Korea has actually standardized their entire healthcare system on top of this particular standard. And then Cynthia is a synthetic patient database of this OMOP CDM instance. So this is nationally available, it's free and synthetic. There's many tools that exist to analyze this sort of data, and we're using, for this presentation, a database that has about 2,500 patients based here in the US. So just to give an example of the complexity of this data, let me jump over here. So this is the actual OMOP Common Data Model database schema. So as you can tell, it is exceptionally complicated. Each of these white boxes here, if we think back to our example within Cat Colab, are themselves actual tables, and then affixed to every single table are many, many different attributes. They could be column names, they could be patient identifiers, all sorts of information that are all baked into each of these white boxes here. And one important aspect to keep in mind about this table, or about this database schema, is that in a sense, in this database schema, the person table, seen in the top left, is a bit privileged in that each event that a person takes into a hospital system generates an entry into the person table for them, where information about their age, their date of birth, demographic information is encoded. And then depending on what sort of event happened, took place, be it just a routine checkup or an emergency room visit, gets broken out into these subtables and stored as data for future analysis. And I just wanted to give a quick overview of just what that looks like. So here we load in our database instance. We look at the tables that are available, and then we can do a quick query to see how many patients are in this database, and there is 2,694 different patients. And coming back to our presentation, let me just skip back over here. There we go. As you can tell, this data is strongly heterogeneous, and that was an intentional aspect, or intentional decision on my part, because I wanted it to mirror a true example or mock-up of scenarios that I have personally been involved with in research in complicated public health sort of analyses I've had to do, where I've had to combine and pull together different sort of data sets. And I should emphasize too, if all those data sets seemed complicated in and of themselves, absolutely. Actually, each of these data sets can actually represent their own field of research and study that people spend their entire careers investigating. And so again, this was intentional to illustrate common sort of circumstances that might occur in evolving or emergency situations such as a pandemic or emergency response, when you have to cover as much information as possible. And just to give a quick example of how the research is typically done within the setting. Give me just one moment. I want to give a quick summary of maybe a typical data science workflow that I might take without categorical methods, and then show you like what a instance of having categorical methods might look like instead. So to give like a routine data science sort of driven approach and analysis here, don't worry if this seems, we're going to go fast through this. I just want to emphasize this general pipeline and architecture that takes place within the knowledge discovery process when you're doing data science. But I wanted to just convey the complexity of it. So we start with loading our different data. Here we load in the census data, we load in the patient data, we load in weather data. As I mentioned in passing earlier when we looked at the census data, all data is actually constrained across the different data sets to the year 2011, because the public data that is available only from the census data is available for only the year 2011. So we have to do a lot of pre-processing. So this block here, what this is doing is filtering down our weather data to the year 2011. So already we're losing a lot of information. And then I mentioned earlier that we're looking for patients with heart attack. So again, we're going to lose even more patients, because now I'm going to go through that 2,694 patient database, look for everyone who has ever had heart attacks. So I filter that down. And so we get a number of different events taking place. And then finally, because of the constraint given by the census data, we have to end up eventually looking for patients that only have a heart attack in the year 2011, because that is only when we have data consistently available between the three different data sets. So as you can see, it's a rather long, drawn-out sort of process where you have to do a lot of this manual sort of kludging together, figuring out, oh, wait, I can't collect all this data over here. I can't use all this data over here because that data doesn't exist over there. And so there's a lot of various intricacies that are at play when you do this sort of process in a typical data science-driven approach. Now, where things get interesting is what if there is a way to, let me come back over here. Oh, actually, yeah. So where things get interesting is coming back to our categorical approaches. What if there's a way to actually fundamentally from the beginning encapsulate and capture the relations that exist between these data sets? What if we can, instead of talking at an ad hoc sort of level where we do this sort of investigation manually using code techniques or methods, what if we can just talk at a high level what these relationships are and then do our maybe analysis and modeling from there? And that's where we get into this notion of what I call attribution. So attribution is what we've already actually gone through, which is how we take perhaps a schema of some data and then turn that into an attribute instance or presentation that we're interested in analyzing later. So just to give an example of the attribution process, let me pull up this notebook here. Is that we go ahead, we start loading up our different data, we load our data, and then this whole thing, if you remember earlier, we were using this syntax where it was like presentation, schema, things like that. We're taking that huge, massive patient database schema that I showed earlier, this thing, and putting it into the language of our algebraic Julia friend attributes.jl. And I'm not going to go through all of this because it is quite a lot of information, as you can tell. But eventually, what we can end up getting to is this data being understood in the language of applied category theory data structures. So we end up being able to bring...
I have a quick question.
Yeah.
When you were creating that list, is there something that allows you to take, like, I mean, a lot of these data sources are already like in databases, so you already have a schema to turn a schema, like a SQL schema, and just write that.
Like just get the attribute out of it.
Yeah. Category.
Yeah, so I'm actually...
Or you're doing it manually. Right.
So I have some really great news about that. So originally, this capability did not exist, like what you're talking about, because ideally, we'd love to have, let's say like we go back to this big old, so entity relationship diagram. Mm-hmm. You know, we take this diagram fully described, we have all our attribute information, we know our relationships, and we just give it to like this piece of software and say like, just load it as like our categorical data structure. So we're actually currently working on that right now within attributes.jl. So myself and a really dear collaborator is Matt Cafaro, as well as Dr. Sean Wu. We've been working closely together to actually make this a reality, not only such that you can have these databases understood in attribute language, but you could also have them directly working with like maybe your bespoke, like SQL, your favorite dialect of SQL database. And you can just, instead of defining everything within memory, you can instead actually have the databases defined at this relational level, like at cat collab, and then you take that diagram at the end and then feed it into your software.
Okay.
Yeah.
Cool.
So it's still actively being worked on, and the final part that I just want to show here is just that we can now understand these sort of complicated data structures or these complicated data sets in terms of the categorical data structures afforded to us by algebraic Julia. So let me come back over here. I think that just for sake of time, I'm going to skip this demo. But I wanted to talk a bit about attribution and just the reflections where still we are at with this overall process is that, as you saw and pointed out, attribution is still a bit non-trivial, as it does require one to do a lot of manual work and requires domain expertise to identify not only how to encode this information in terms of attribute, but also what might be the morphisms relevant between data sets, like what column is actually in fact this column over in these two databases, or even not databases, but tables. But in thinking even broader in the future, like between databases sometime, like this still requires a lot of domain expertise. And the question of why attributify is that as I said earlier, rather instead of going through this ad hoc process of knowledge discovery where you have data science engineers or various computer scientist engineers going through your data sets and just kind of manually figuring out what these relationships are and getting knowledge discovery pipelines built in an ad hoc manner, what if you can actually just go back to the original data sets layouts and then define your relationships and morphisms at a high level, and actually, as you need changes to be built and modified throughout maybe the development of a crisis situation such as responding to a pandemic, you can then at a high level define how the model has changed and see that reflected or back propagated through your knowledge discovery pipeline and process. And just some final thoughts on demonstrations here is that the thoughts on categorical data sciences, I still see that as really ripe for exploration and innovation. I think it really can play a significant role in simplification and improving general pipelines and analysis analytics needed to be done across very strongly heterogeneous settings. And I see it's a problem domain space that continues to grow. As I was kind of mentioning earlier, I see categorical data science not as a replacement to any sort of traditional data science methodology, but rather a framework or a place to do data science with your favorite tools or models. And just to give some maybe technical nitty-gritty pieces that I'm excited about is, to your point, we're working on attributes that can handle large-than-memory databases, things like that, such that you can define your relationships and be able to compute upon huge data sets. Like in my case, I do research on about 35 million patients worth of data at Northeastern University. I'd love to be able to start bringing more and more this sort of attribute machinery to these extremely large patient populations. And now we come to the conclusion. So just to recap with our definition, compositional public health is an emerging field at the intersection of category theory, public health, and engineering, which utilizes tools from applied category theory for applications across public health. And just some papers and open questions in CPH at the moment. If any of this was interesting, maybe some of these questions might be interesting to you, as there's still a lot of the theory and engineering that still needs to be developed and understood. So just to highlight 4 questions here that have been on my mind as I've been thinking through this space is, perhaps maybe like 1, what do we need to enable multimodal health informatics, such as bringing together like high-level patient information like from doctor's notes that you get at a hospital, combining them with maybe your blood pressure readings or like a heart rate EKG. There's this paper that's fantastic called Sheaves are the Canonical Data Structure for Sensor Integration by Robinson. Again, there's another question, how can we use spatiotemporal sheaves to model epidemics? This is from the paper Towards a Unified Theory of Time-Varying Data by Bumpus et al., who are based over at University of Florida. What would a sheaf-based query language look like? This is taking inspiration and building on some work from algebraic databases by Schultz et al. And then finally, one question that's near to my heart is, how do you model causal processes in applied category theoretic frameworks? And this is based maybe on the paper of Causal Theories, Categorical Perspective on Bayesian Networks by Dr. Brennan Fong. So yeah, as I was mentioning earlier, if you want to get involved with any sort of these developments, Algebraic Julia, you can Google them. You can also take a picture of these QR codes. I'll leave them up at the end when we're talking about questions. But you can get involved with the open community there. There's also the CAT Collab community. So if you're interested in collaborative modeling, CAT Collab is the place to do it. Some additional resources for applied category theory, these are just some of my curated resources, is the course Applied Category Theory for Engineering Design at MIT. There is a textbook and coursework available for that. CMPT 856, Categorical Mathematics for Compositional Modeling at University of Saskatchewan. I should mention at MIT, this course is taught by Professor Joel Zardini. This course is taught by Professor Nathaniel Osgood. And then also the Algebraic Julia and Topos Institute blog is a great place to be learning where developments are happening in applied category theory. And some final thoughts is that applying applied category theory is still a hard problem. We're still working on making this a very easier problem. As I mentioned earlier, we're still kind of at this interesting transitional period where we have people who need to still sometimes wear multiple hats to understand a problem, but we're slowly getting to this emergence where we're hoping that, as I said earlier, the hope would be to have not so much the existence of people having to wear multiple hats, but rather just hybrid approaches in the end. And I should also emphasize that compositional public health is just one application of these categorical methods. I've seen work being done in control systems, such as the work of co-design done by Joel Zardini and Andrea Sensi. There's also applications taking place in robotics, such as by Dr. Angeline Aguinaldo. And then some additional areas I think are going to play a huge role in the continued future of applied category theory is double category theory, sheaf theory, and topos theory. I think these are going to be really important areas just to continue to investigate and drive implementations of categorical understandings of these different sort of data science approaches. And just to give a thought of next steps here with compositional public health, I'm currently working with Professor Nate Osgood on a paper describing compositional public health. We're also working with some collaborators to kind of give a vision for what this field could be in the next like 5 or 10 years. Currently, we're working on putting the final details on a proposal for a CPH workshop in Canada at the Banff International Research Station. So the hope will be to hopefully have that going on this summer, a 5-day event for that. And then to further work with and develop in algebraic Julia further as one of the contributors there. I hope to see it continue to grow for more and more practical applications. Hope to be applying to ACT 2025 to share more about this to the broader category theoretic community, finish my MS thesis work, and continue exploring collaborations, mentoring, and contributions. I just want to give a huge shout out to multiple people for both helping me make this presentation as well as supporting me along my journey. I want to give a huge thank you to Professors Emilio Maiciello and Nosan Yanovsky for allowing me to present here today. Thank you so much. And thank you to all these wonderful people who have made this talk possible and this work possible. So just to end off, just a fun little quote from Joel Zardini is, I think, encapsulates the notion of applied category theory is that to keep in mind that your system is just a component in another person's system. And I'm excited to see how we can continue to grow and iterate on that idea. So with that said, thank you all so much for your time.
Questions, anybody?
Yes?
What was the most frustrating part of building this system out?
I would say, so like I mentioned earlier, there's still this problem between having to know, so the way I got into building the system is I decided to do a degree in mathematics. And that's kind of the rub a little bit. It's not like, I feel like we're still kind of at this problem where just because there's a lot of promise here, but the barrier to entry is still rather high. And I, as much as I love mathematics, I don't want to necessarily say to anyone who wants to use these categorical methods, go do a degree in mathematics. I think there needs to be still a point where this onboarding, this bringing people who might not be those formal mathematicians into this space even further. So that's just one thought.
Right, how to write a category 3 for a working programmer.
Yeah, and I mean, Bartosz Milewski.
Do it without necessarily knowing category theory, but you have category theory is the underlying element. Like the way I look at it, when we're talking about the major problem is basically these tools are very immature. We're just getting started, basically.
Yeah.
Right? Like in programming languages, I mean, we've had 30 or 40 years of innovation, and we're still most people aren't even doing functional programming and things like that. People are in basic still.
Exactly.
It takes a long time to grow, and this is a new type of language that really has been just reserved with the mathematicians largely, and is finally starting to leak out into some of the more practical.
Yeah, and I think
it's very exciting.
It's very exciting.
What the ACT people are doing.
Yeah, and I think what's really exciting here is I think this is just a beautiful example of the amount, the creativity that exists between the synergies between different fields, be it mathematics and computer science, mathematics and epidemiology, so on and so forth. I think we're still in this area of where I want to see this bridging, this cross-communication stuff happening. So as I was saying earlier, just towards the end here, one of my dreams for that workshop that we're hopefully going to be hosting is to get mathematicians and public health practitioners in the same room talking and just seeing what comes of this, especially using maybe some of this discussion here as driving some of that discussion, facilitating some of this discussion, because I think there is a lot of people, like this might be a generalization, but I think there's many mathematicians who are looking to become like applied or using their work in some applied setting, and I think there might be vice versa, you know, maybe more domain-specific researchers looking to be a bit more mathematically rigorous. And I think finding those people and meeting them where they're at with fields such as compositional public health is, I think, a, you know, really exciting aspect that allows, you know, this work to grow. So.
Trying to get back to the question I asked earlier.
Oh, yeah.
Let's say you have one of these, you know, categories that represent the data scheme.
Yes.
And I was saying when you're an object, you know, you showed that, okay, obviously everybody has an identity morphism, which would be something like employee ID, just an idea what would a non-trivial morphism from an object look like or mean?
Yeah, so in my mind, one morphism that could be non-trivial, you know, I'm thinking. I mean, the canonical, like...
or even just how to think of these things.
Yeah, because I was going to say, like, if we think about primary keys, like if we're looking at database schemas, like getting into the details for a second, when I think of primary keys that exist on like tables, those are going to be the identity morphisms. But if we look at the foreign key relationships that exist between database tables, that's where I'd say like we could start thinking about non-trivial sort of relationships there. And then one thing I didn't talk about is something that I do want to explore more of, and I didn't have a great demo to show about it, which is why I didn't get a chance to talk about it, is thinking around like constraints, like especially like in terms of database constraints, be it like enforcing certain type checking or enforcing certain constraints are satisfied across databases. And one thing that I didn't mention when I was answering your question about like we take a schema diagram from like a database and load that, like say to the software, here's my diagram, load it, is we're actively also building out that ability to have those constraints be respected in the software itself. So, so that's something I didn't get into just because that is still like, it's very like still in the implementation. It's not quite baked yet.
Let's answer your question, right. Think of the employees and departments database schema. Think of manager. Okay. It's a morphism from employee to itself.
That's the kind of thing. Okay, good.
Yeah.
Right, now you said point being a morphism, then when they compose, they should be consistent.
Exactly.
Yeah.
Constraints often, not always, in our experience, can be represented as the existence of a pullback.
Oh, okay.
And that's a very good way to model it.
Okay. Yeah, no, you're absolutely right. The problem that we have isn't so much on the mathematics side, it's actually been like on the engineering side a little bit, just like actually translating this into the software that we need. But you're exactly right. It's just... and
that's easy to calculate, right, actually, the existence of a pullback.
Yeah.
Just like constraint, because it's just it's the set product thing.
Yeah. No, that makes sense.
I just wanted to make a comment. So you showed the access paper, so I just wanted to, because I think people here might be interested in it. So there's kind of an interesting evolution of this idea. So in the beginning you had David Spivak, he wrote this paper about C-sets, which is basically the idea that, okay, so a finite category is a database schema and then an instance is a functor from this category to set. This paper is then the next evolution of this idea where you want to include attributes. So what do? Well, instead of having a category being a database schema, they have a profunctor being a database schema. What's a profunctor? It's a category where you chop up your category into two pieces. You have one category C and one category D, and then you're only allowed to have morphisms going from C to D. And you can have morphisms inside of C. And then in this paper, what they do is they have D being a discrete category. So that means that the attributes are in this other category D. And then you have morphisms going from left to right. So now you have, employees, departments, and then you have string on this side, and the attributes are only allowed to go from employees and departments to string. The first paper you referenced was, and then instances have to respect the structure in some way. And then the other paper you had, algebraic databases, is then even more structure, where now you have a profunctor between a regular category, and then on the right-hand side, where now you have this attribute category, is now an algebraic theory. So now this thing can have products, right? And then, so now not only do you have string, you also might have, integers. And then you also have the product and addition or multiplication or whatever. And now you also have constants. So now when you take an instance, now it has to respect a ton of structure. So now you can do your database instances are infinite, and they have this algebraic structure on it. So yeah, I just wanted to.
Oh yeah, no, thank you. Yeah,
The algebraic databases paper, that this would be the paper, because I actually, what I was going to ask after the talk was actually to get the link directly to this, because I've been, interested in the subject, so.
I don't.
That's a paper I want to read for sure.
And I don't know, Nosan or Emilio, I can provide the slide deck. I don't know if you can host it on YouTube or give a link to it on YouTube or anything.
Copy a different number down that he uses.
But anyways, this paper is on
Where does
different number.
databases as fiber bundles fit into that?
Right, so that's actually related to what you were saying with constraints. So this was just one. Nowadays there's lots of different ideas about how you could do it, but so what you're referencing is so yeah, as you said, there's this desire to model constraints. This is a big thing in database theory. So one way that Spivak was thinking about it was, okay, I have a database instance and I want it to satisfy some property. So what you can do is you can have a database instance and a map to another database instance. Yeah, how do I explain this exactly?
Stand up.
Well, I don't have enough time to explain it properly. The idea is that if you have a lift, then this constraint is satisfied. So it's like, okay, I have this property that I want to hold, I model it as a morphism, and then if this lift exists, then this property holds. So that's another design choice, and I would say that's not fully implemented or understood in any way, especially when you want to go to the algebraic setting. There's some understanding of stuff there, but it's not fully fleshed out. Especially because in database theory, that is that's kind of the main thing that people think about, and that hasn't been fully done yet. But the thing that is really powerful in the algebraic setting, the algebraic databases, is the querying. That is really well understood, and you can be implemented. And there's also this company Connexus that has this implemented as actual software using that paper, the algebraic databases paper.
Yeah. What is that language called? Is it AQL or?
Yeah. So now it's CQL.
CQL. Okay.
They changed the letter in a couple of years.
Anyways, let's thank our speaker again. We can hang out and talk all we want. Thank you very much.
Thank you.